Mihira, we need to closely monitor patient 452, Mr. Paul. He's at high risk for seizures due to his recent brain surgery. His sodium levels are slightly low, and he's been experiencing some fluctuations in blood pressure, both of which can trigger seizures.
I understand, Nino. I've already implemented seizure precautions. I've raised the bed rails, padded the side rails, and made sure suction equipment is readily available.
Good, but we need to be proactive. Educate his family about seizure first aid and the importance of calling for help immediately. Also, keep a close eye on his oxygen saturation levels. Sudden drops can precede a seizure. And Mihira, administer anti-seizure medication as ordered, but be prepared to assist with intubation if necessary.
I'll make sure the respiratory therapist is aware of the situation. We'll be ready for any eventuality.
Excellent. Remember, early intervention is crucial. Any signs of seizure activity, no matter how subtle, should be reported immediately. Mihira, based on the symptoms you've described, the blurry vision, blind spots, or seeing flashing lights, specifically in just one eye, sometimes with and sometimes without a headache, it sounds very much like a condition called ocular migraine, also known as a visual or retinal migraine. This is a provisional diagnosis, meaning it's our most likely initial assessment, but it's important to understand what's happening. Ocular migraines are essentially temporary disturbances in the blood flow or nerve activity in the eye or the part of your brain responsible for vision. Unlike a classic migraine, which is primarily defined by a severe headache, the key feature of an ocular migraine is the visual change. These visual episodes are usually harmless and brief, often resolving within minutes, but they can certainly be frightening and disruptive. The goal now is to confirm this diagnosis and rule out other, potentially more serious causes of sudden vision changes. To ensure we have a complete picture and that your eye health is not compromised, Mihira, we need to arrange for some further tests at the hospital. This comprehensive screening will help us look at all the factors. We will start with a detailed vision test to fully assess the clarity and field of your sight. We will also perform a blood test to look for any underlying medical conditions that might be contributing to these symptoms, such as issues related to circulation or blood pressure. These tests are simply precautionary steps that help us move from a provisional diagnosis to a confirmed diagnosis and, most importantly, give you peace of mind and the right advice for managing your health going forward.